Book 1. Unit 1. The Role of a Healthcare Manager. Exercise 5, page 5.
Dear Hiring Manager, I'm applying for your open management position because I have plenty of experience as a healthcare manager. Most of my experience is in talent management. Previously, I was a staff manager at a hospital. I mainly planned and organized staff schedules. This taught me excellent organizational skills. I also monitored the performance of staff members and I ensured that everyone followed company policies. During this time, I acquired excellent leadership skills. For example, I learned how to direct the staff effectively. This required me to earn their trust and respect. Later, I became the hospital's HR director. In this position, I controlled the hiring and firing processes. It was challenging, but I learned something valuable. The right decision isn't always the most popular decision. Thank you for your consideration, Jeanette Lee.
Unit 2. People in Healthcare. Exercise 5, page 7.
Olympia Health Partners. About us. At Olympia, your health is our priority. We always have a practitioner or physician assistant available to serve you. For non-emergencies, please schedule an appointment. Then, you can see a general physician or nurse practitioner. He or she will refer you to a specialist if necessary. Your doctor may recommend surgery. Our surgeons perform all operations at our facilities. Do you need further testing or medication? Our imaging specialists and pharmacists are right here in our facility, so you don't have to go elsewhere for those services. After an operation, you may require therapy or counseling. Our physical therapists and counselors work closely with our physicians. They'll help you get back on your feet. Just interested in routine tests or vaccinations? Get in faster by making an appointment with a registered nurse here.
Unit 3. Healthcare Facilities. Exercise 5, page 9.
Resume. Name, Terry Wallace. I have several years of experience in healthcare administration. The details of my previous positions are listed below. Oak Hills Mental Health Facility. I worked at Oak Hills for 2 years. The facility housed both a practice and a consulting firm. My duties there included administering medication to patients. I was also responsible for clients' paperwork. Standish University. I managed patient intake at SU's research facility. I recorded the subject's blood work. I also conducted pre-trial physicals. Somerset Elder Care. I worked in Somerset's nursing home and rehabilitation center. I was responsible for coordinating elderly patients' physical therapy sessions. City of Spencer. I currently work for Spencer City's Public Health Department. I ensure that the region's facilities follow regulations. This involves frequent travel to hospitals and clinics.
Unit 4. The Structure of a Healthcare Organization. Exercise 5, page 11.
An overview of healthcare management organization. Healthcare organizations are structured in different ways. Usually they fall into 2 categories. The first category consists of for-profit organizations. They are funded by investors. The second category consists of not-for-profit organizations. These may be private or government-owned organizations. Regardless of the structure, a governing body holds the most responsibility in a healthcare organization. This group chooses the CEO, Chief Executive Officer, of the organization. he or she manages its overall needs and goals. Typically, this doesn't include day-to-day operations. That's what the COO, Chief Operating Officer, is for. This person ensures the organization runs smoothly. The CFO, Chief Financial Officer, oversees finances, but this can be a huge task. That's why a controller assists with accounting in many large organizations. A treasurer manages financial assets. Finally, the CIO, Chief Information Officer, oversees data processing systems.
Unit 5. Types of Health Insurance. Exercise 5, page 13.
Hilltop Insurance, Plans and Services. We have insurance plans to fit every need. Our most popular plans are listed below. The Green Plan. Our basic policy is best for young, healthy people. It only includes hospitalization and related services. The Blue Plan. Most people prefer a more comprehensive coverage. That's what our Blue Plan is for. Its benefits include a wide variety of services. It does have a few exclusions, though. Check our detailed policy description here. The Yellow Plan. Maybe you can afford routine medical care without insurance. But what if you have major unexpected medical expenses? Protect yourself with the Yellow Plan. Don't let a catastrophic event leave you bankrupt. Additional coverage. We also offer supplemental and disease-specific plans. These options are for people who need additional coverage. Not sure which plan is best for you? Call us for a free consultation.
Unit 6. Features of Health Insurance. Exercise 5, page 15.
From Caroline Smith, Supervisor, to Eric Kraft, HR Manager. Subject: Insurance Plan. Mr. Kraft, I think that we should change the insurance plan for our employees. Our current group plan is simply too expensive for members. First of all, we have a very high premium. In addition, our employees pay expensive co-payments. Plus, it has a high deductible. Most employees don't even meet it. I found an alternative plan with a different provider, Harrison Insurance. They offer a better co-insurance policy. It has a low maximum out-of-pocket expenditure and a high lifetime limit. Plus, the provider choice is excellent. It is only fair that our employees with pre-existing conditions keep their current physicians and their COB, coordination of benefits. Also, employees with supplemental plans don't have to worry either. Let's make the switch. We'll all be happier and healthier for it. Caroline Smith, Supervisor.
Unit 7. Health Insurance Providers. Exercise 5, page 17.
Trying to choose a healthcare plan? There are several types of carriers to consider. HMOs, health maintenance organizations, give members access to care for a fixed payment. Network model and group model HMOs have the greatest selection of physicians. Other HMOs, like closed panel or staff model organizations, only work with certain physicians. Open panel and IPA model HMOs have a little more flexibility. PPOs, preferred provider organizations, are also popular. Members can select preferred providers or providers outside the network. However, they pay a discounted rate with preferred providers. Health savings accounts are another option. They have a competitively low premium. However, account holders must budget their balances wisely. Otherwise, they could lose money at the end of the year.
Unit 8. Financial Management. Exercise 5, page 19.
Career Now, Jobs. Listing ID 084544. Health insurance provider seeks financial manager. Heartland Health Insurance needs a financial manager for its accounting department. The department handles both managerial accounting and financial accounting. So applicants must have experience preparing data for both internal managers and outside stockholders. The manager will generate reports detailing Heartland's costs and revenue. He or she will also advise executives on financial matters. This involves recommending the best ways to borrow and invest funds. As an insurance carrier, Heartland is responsible for third-party reimbursements by compensating all care providers with retrospective reimbursement. This involves less risk than prospective reimbursement. We welcome applicants who have experience with either type of compensation. Either way, applicants must have extensive experience working with both members and providers.
Unit 9. Assessing Costs. Exercise 5, page 21.
The manager's resource. Assessing costs. Businesses aim to make a profit and avoid a deficit. In order to do so, they must assess their costs. The process of assessing costs involves several steps. Cost allocation is the first step. This breakdown divides costs by departments in an organization. Then, each department can determine its fixed costs. Sometimes, departments can convert these into variable costs. That way, they're flexible. In other words, they decrease when revenue decreases. Alternatively, departments can divide costs by traceability. Direct costs can be traced, while indirect costs cannot. These numbers define a service's product cost. After that, a business must calculate its break-even point. Then it can set the rates that it charges customers.
Unit 10. Billing. Exercise 5, page 23.
From Martin Jones, consultant, to Ellen Ross, manager. Subject, billing practices. Ms. Ross, I'm writing to explain your organization's deficit in working capital. Currently, you have more liabilities than assets, but this isn't because third parties are failing to pay. Rather, it's a result of the organization's internal processes. Simply put, the organization's billing practices are inefficient. It takes too long to collect on accounts receivable, and this leads to a shortage of cash. The answer to this problem is better interdependence. Departments have to work together to prevent delays. Doctors need to provide immediate documentation to the coding department. Then, the department can send bills out more quickly. If you have any questions, please don't hesitate to contact me. Sincerely, Martin Jones, Financial Consultant.
Unit 11. The Budget. Exercise 5, page 25.
The manager's resource. Budgets. Budgets help businesses manage their finances. A basic yearly budget is called an operating budget. It details how much money an organization needs to operate. It consists of an expense budget and a revenue budget. An expense budget calculates a company's outflows. These are expenses like rent, salaries, and utilities. Conversely, a revenue budget predicts future inflows. Combining these numbers gives a company its ending cash levels. This is the excess money it has to work with. These funds can be used in long-term investments. Such capital budgeting can earn additional revenue for the company. The following chapter outlines how businesses design these various budgets.
Unit 12. Supply Chain Management. Exercise 5, page 27.
Spencer Community Hospital, Supply Management, Quarterly Report. Recent changes in supply chain management have improved hospital operations. Traditionally, we have used the JIT, just-in-time method, to manage inventory. This has been an excellent form of cost control. It prevents shrinkage and limits our stock of non-productive goods. We receive them just before using them. As a result, they rarely become contaminated or expired. This in return saves money. Unfortunately, strict JIT was also causing problems. Sometimes shipments were late or we experienced stockouts. And in healthcare, a patient's life could depend on the proper supplies. That's why we decided to incorporate a new method. Now, we use a combination of JIT and ABC analysis. This ensures that we never run out of the most important items, but we still maintain small inventories for less critical supplies.
Unit 13, Human Resources Management. Exercise 5, page 29.
Evergreen Healthcare Annual Human Resources Audit. This year's audit revealed an inefficient distribution of Evergreen's human resources. Some departments are well organized. The clinical staff is one example. They are clearly benefiting from last year's talent recruitment. However, workforce planning needs reassessment in other departments. This is especially true of the administrative staff and support staff. There's too much overlap between the duties of these personnel. In addition, the responsibilities of these two groups are not clearly defined. This is causing confusion and mistakes. While some tasks are completed twice, others aren't done at all. Workers simply aren't sure who is responsible for them. We recommend that the company perform a job analysis for these two departments. This process will identify any duplication of their day-to-day tasks.
Unit 14, Hiring Considerations. Exercise 5, page 31.
From Tom Reynolds, HR Manager, to HR Staff, regarding hiring procedures. Unfortunately, our team recently hired some unqualified job candidates. In response, we are changing our hiring procedures. We need to make sure that only the best candidates receive job offers. From now on, we will rely more on private recruitment. We're hiring a recruitment consultant to help us with this. She will also help us develop new advertising and job descriptions. We hope these changes will bring in candidates with more experience. That way, we can spend less time on training. We are changing our application and interview procedures too. Candidates must attach at least 2 references to the application. If a position requires licensure, we need those documents as well. We are also encouraging interviewers to use behavioral-based questioning. This gives them additional insight into candidates' experience. Thanks for your cooperation.
Unit 15, Employee Engagement. Exercise 5, page 33.
Why should you work for Saranda Healthcare? Here at Saranda, we are serious about employee retention. That's why we have the lowest turnover rate in the business. So, how do we do it? Well, Saranda values employee engagement. That's why we provide all employees with excellent benefits. For one, we believe that employees shouldn't have to fight for sick leave. And from our research, paid vacation increases employee satisfaction. Of course, we also provide employees with medical coverage. Plus, we have an excellent retirement plan for long-term employees. But that's not all. our monetary compensation is the best on the market. We know this because we regularly benchmark it. Whether your position is salaried or hourly, you'll enjoy competitive pay. So, what are you waiting for? Apply now for the job of your dreams at Saranda Healthcare.
Book 2. Unit 1. Describing change. Exercise 5, page 5.
Sunside Rehabilitation Hospital. Annual Performance Review. Board members and other interested parties should know the results of this year's performance review. Overall, the outpatient department is doing well. There was a rise in patient satisfaction, a key indicator of success. This is probably because staffing levels increased this year. As a result, the wait times for initial appointments decreased sharply. In addition, our staff turnover rate plummeted. Previously, we had difficulty retaining excellent therapists. Therefore, we expanded both our staff benefits package and our new equipment budget. It appears that these measures helped. Unfortunately, the rate of payment on accounts receivable gradually shrank throughout the last year. We can attribute this decline to the growing costs of health insurance. Patients are often unable to pay out of pocket. We need to focus on collection efforts to stabilize these numbers. Another option is to implement payment plans. That way, we would receive a steady flow of payments. Hopefully, our default numbers would stop fluctuating from year to year. The full report begins on page 2.
Unit 2. Managing a Team 1. Exercise 5, page 7.
The manager's resource, forming an effective team. Teamwork is a key part of successful management. However, many people don't know how to create an effective team. Here are some questions to consider. Is a team necessary? Are the costs of meetings and other group activities worthwhile? Sometimes, letting employees work independently is more efficient. What kind of team is appropriate? Sometimes you want a group with expertise in one discipline. In other situations, a cross-functional team is better. That is especially true if you want the results to reflect multiple perspectives. For how long will the team be collaborating? A committee is best for addressing ongoing issues, even if its members change. On the other hand, a task force is well suited to specific short-term goals. What is the team agenda? It's good to establish expectations from the beginning. Then you can easily gauge success, and tracking positive results helps team members stay committed. Who belongs on the team? Consider different personalities. Are participants able to compromise? Are they good at coordinating with others? All these factors affect the success of a team.
Unit 3. Managing a Team 2. Exercise 5, page 9.
The Life of a Manager, a blog by Darren Gregory. Post, November 12th. How to be a good manager. I consider myself to be an accomplished manager, and many people ask me how I do it. I attribute much of my success to clear communication. 1. Clarity is a vital part of good leadership. Team members must understand not just their overall goal, but also their individual roles. That's why I recommend establishing written guidelines immediately. And make it a collaborative effort involving the whole team. This makes everyone feel included. It also allows you to learn about the different personalities on your team. 2. The guidelines identify who the team members should report to. They should also outline duties and deadlines. That way, your expectations are clear. Later, these guidelines provide a useful way to evaluate performance. They help hold everyone accountable and prevent free rider syndrome. You'll know that you're assigning credit where it is due. 3. Communicating guidelines is a good start, but many other factors matter too. That's why my next post will focus on building trust between team members.
Unit 4. Communication. Exercise 5, page 11.
From Justin Hopkins, Department Manager, to Ashley Wells, Executive Officer. Subject, Meeting Summary. Ashley, you asked me to update you on yesterday's meeting. I wish I had better news, but honestly, it was a disaster. Basically, we left the meeting after making no progress. The goal was clear enough: determining how to allocate funds. However, each manager wanted the money for his or her own department. People kept interrupting each other. I didn't even have an opportunity to complete my presentation. Others were getting defensive or weren't being open-minded to suggestions. I felt bad for poor Henry, who was in charge of the meeting. He didn't even bother with a vote. There was nothing even approaching a consensus. Henry and I both attempted to bargain with the different managers, but our problem-solving efforts were unsuccessful. After 2 hours, we couldn't reach a resolution to the conflict. I hate to say it, but third-party mediation might be the only solution. Would you consider supervising the next meeting? It might be the best way to improve communication. Justin.
Unit 5. Management Technology 1. Exercise 5, page 13.
Management systems for the healthcare industry. Streamline your facility today. Course Introduction. Unit 1. Most students already know the basics of IT. It is assumed that students are familiar with word processing, simple spreadsheets, and email. This course expands on that knowledge by introducing some industry-specific software. During Unit 1, students explore software to simplify tracking time, hours worked, and attendance. The emphasis is on automating certain aspects of the HR department. Unit 2. This unit is devoted to improving organization. Students compare different scheduling software and other useful productivity tools. Unit 3. The last unit concentrates on specialized areas. Students learn about the most popular enterprise resource planning systems in large organizations. They also consider the merits of various cost accounting systems for modeling profits and losses. Finally, the course covers the pros and cons of automating aspects of customer relationship management, CRM.
Unit 6. Management Technology 2. Exercise 5, page 15.
Community Health System Goes Digital by Warren Bell. This week, Rowan Brook Community Healthcare, RCH, announced its plans to go digital. All paper medical records will soon be converted to EMRs, electronic medical records. Specifically, the community healthcare system will implement a widely accessible electronic database. All of a patient's healthcare providers will be able to share medical records on a need-to-know basis. An RCH spokesperson claimed that this will increase the standard of care. He said it will reduce errors and allow clinicians to better prepare for appointments. That way, medical personnel can focus on patients, not charts, during appointments. However, some citizens oppose an automated system. They are concerned that their medical histories and lab results won't remain secure. Currently, most clinicians' offices have internal computer records, so it's easy to keep data private. In contrast, this new system will connect primary care offices with external providers. Yes, the data will be encrypted, but is this sufficient? Will we need better regulations to protect our PHI, personal health information? What do you think? Write in and share your opinion.
Unit 7, Strategic Planning 1. Exercise 5, page 17.
From Amanda Ling, Executive, to Jeremy Krakowski, Executive. Subject, Mental Health Facility Expansion. Jeremy, I'm excited to move ahead on our new mental health facility. As this is a specialty clinic, it will likely have unique needs and priorities, so I don't think we can simply duplicate the current strategic planning from our existing medical clinics. After all, different market forces may be at play. Of course, things like our overall mission, vision, and core values will remain the same. But other parts of development and, ultimately, execution may be different. With that in mind, I suggest a SWOT analysis. This should provide us with invaluable information about internal strengths and weaknesses. Hopefully, it'll also highlight opportunities available to us and possible threats that might interfere with our plans. Maybe our previous strategies will be applicable, but if not, we can adapt our plan in advance. In the long run, a SWOT analysis should save us time and money. I definitely recommend doing one prior to making any important decisions. However, I'd appreciate your thoughts on the matter. Best, Amanda.
Unit 8, Strategic Planning 2. Exercise 5, page 19.
The manager's resource. Elements of strategic planning in healthcare. To accurately predict successes in the healthcare marketplace, you must consider a variety of factors. Market assessment. A market assessment is no easy undertaking, but it does yield vital information. It uses quantitative and qualitative methods to analyze every part of the healthcare market. Workforce. Are there enough qualified workers to meet the demands of your organization? Consumers and payers. What do patients and insurers want? How can your organization fulfill those needs? Innovations. How are technological developments likely to change the industry? Can you benefit from them? The regulatory environment. How can you ensure that your organization is in compliance with all applicable laws? What costs will this involve? Competition. What strategies are your competitors adopting? How can you ensure that your organization prospers? Organizational assessment. Rather than analyzing external factors, an organizational assessment determines a group's internal strengths and weaknesses. It uses a baseline scenario and a volume forecast to create quantitative data. It assesses key financial indicators over several years.
Unit 9, Implementing Strategies. Exercise 5, page 21.
From Jake Billington, Manager, to Planning Team Members. Subject, Strategic Planning. Team Members. I reviewed our most recent plan for the new clinics. I feel like the strategic direction is solid. Creating 3 pediatric clinics in the Ben Stone area is executable within the timeframe. Currently, there is only one clinic in the region, operated by one of our competitors, and it's virtually impossible to find parking nearby. I was pleased to see that you addressed parking concerns in your plan. So, as far as strategy identification goes, it's a good one to pursue. A parent with a sick child is already stressed. That kind of consumer appreciates anything we do to make life easier for them. Consequently, this strategy should enable us to grow our market share, and that's the desired outcome. So, Your scenario analysis appears sound. The tactical plan involves opening these additional branches within the next 18 months. However, before we implement the plan, I need an assessment of the 3 proposed clinics. Which one should we prioritize? What resource allocation will provide the best return? We must determine this before the communications rollout. Keep up the good work, team.
Unit 10, Monitoring Strategies. Exercise 5, page 23.
From Jennifer Uribe, Manager. To Brett Weiland, Manager. Subject: Bentonville Regional Hospital. Brett, I want to discuss the closure of Bentonville Regional Hospital. On the one hand, this is good news. Bentonville was our competitor, so its closure means more business for us. On the other hand, we need to learn from Bentonville's mistakes. Otherwise, we might find ourselves in a similar position. I recently hired 2 administrators after Bentonville laid them off, and I asked them about the hospital's weaknesses. A principal problem was a rigid culture. We all know that healthcare is becoming more patient-centered, but Bentonville lacked the necessary flexibility to adjust to that shift. Senior staff members expressed resistance to change. Additionally, executives refused to fund an analysis of the problem. To avoid a similar situation, let's reassess how we monitor our strategies. We can look at factors like consistency. Are we regularly checking for variance in our procedures? Let's also examine our dashboard system. Are our targets reliable indicators of performance? I want to make sure that our practices support our overall focus. I'd appreciate your input. Jennifer.
Unit 11, Healthcare Marketing 1. Exercise 5, page 25.
The Manager's Resource. Principles of Marketing in Healthcare. Effective marketing is critical to the success of a product or service. The principles of marketing revolve around the idea of satisfying the customer. What does the market need? How can the services of an organization fulfill that need? Ideally, organizations attract lifelong customers. One way to achieve that is to provide customer value. Consumers must feel that they benefit from the services they receive. Otherwise, why return to the same vendor? There are several steps in developing a marketing strategy. Analyze the market and work on competitive positioning. In other words, what is your organization's differential advantage? How is your organization better than other similar ones? Decide on a core strategy. Define the target market. A concentration strategy focuses all of your energy on one particular market. For this to succeed, you must be certain that your offering matches consumer demand. A multi-segment strategy lets you spread your message across multiple targets. Out of the different market segments, which one should you target? Set marketing goals and select tools.
Unit 12, Healthcare Marketing 2. Exercise 5, page 27.
Dear Miss Knight, I understand that there is a position open in your marketing department. I would be a great fit. For the past 3 years, I have worked for Wellington Prosthetics. That primarily involves B2B, business-to-business transactions with hospitals and large healthcare networks. Therefore, I'm familiar with the requirements of the organizational market in comparison to the consumer market. However, I also understand that the organizational market is still influenced by consumer behavior. Thus, I appreciate the effects of consumer psychology and derived demand. During my time at Wellington, I spearheaded a major campaign. This involved a complex marketing plan. Of course, I had to consider the 4 Ps. I was personally responsible for defining the product and implementing promotion. I also worked with the managers who established the price and place elements of the plan. The campaign was extremely effective. We won a major government contract. Now I'm seeking a new challenge. I would welcome the opportunity to work on campaigns for your company. You will find my resume enclosed. Sincerely, Ethan Williams.
Unit 13. Healthcare Quality. Exercise 5, page 29.
The Fenn Buckley Clinic. About us. The Fenn Buckley Clinic continually ranks as the area's best clinic for delivering excellent healthcare services. Year after year, we earn national accreditation, and we hold ourselves to the highest healthcare standards. We define quality as helping you to achieve your desired goals. But how do we ensure that we follow best practices? We place a strong emphasis on building interpersonal relationships. We care about you. All of our staff members have the appropriate certifications. We also believe in the importance of ongoing education. We regularly send our practitioners to courses and conferences. That way, they're familiar with the latest scientific and technical developments. We outline our ethical principles in a written code of conduct. Our operations are efficient. You'll love the short wait times at our clinic. We're effective. We only proceed with a treatment plan once we're sure it's right for you. Our clinic is full of convenient amenities, like an on-site pharmacy. Get prescriptions filled right here, quickly and conveniently.
Unit 14. Quality Concerns. Exercise 5, page 31.
Quality Assessment Report. 5. Appropriate use of resources. Overall, the hospital's resource allocation is acceptable. Effectiveness is average in comparison to other similar institutions, but there's still room for improvement. Fortunately, underuse is not really a concern. Physicians are not overlooking appropriate treatments. However, overuse is a definite concern. Physicians at the hospital are repeatedly overprescribing antibiotics. This trend is apparent across several departments. Indiscriminate antibiotic use provides no benefit to patients suffering from viruses. Moreover, it increases the risk of antibiotic-resistant strains of bacteria, and that is a threat that hospitals must take seriously. Another possible area of overuse is knee replacement surgeries. The data is somewhat puzzling. The hospital performs 30% more knee replacements than other facilities in the region. This variation could indicate that unscientific methods are determining who receives surgery. However, it is also possible that the hospital's good reputation for knee replacements attracts more patients. Regarding misuse statistics, preventable medical errors dropped by 8%. While that is admirable, the hospital should strive to lower them further.
Unit 15. Quality Improvement. Exercise 5, page 33.
The manager's resource. Methods of quality measurement and improvement. Overall, quality is a challenging factor to measure. However, many aspects of quality are measurable. One common approach is CQI, Continuous Quality Improvement. Essentially, this requires employees to spot and address problems as they occur. In this sense, problem solving is an ongoing process. SPC, Statistical Process Control, is a useful metric for gathering CQI data. Another popular approach is Six Sigma. It is intended to eliminate variation. Tools for measuring quality. A check sheet is a simple yet effective tool for collecting information. Just be sure that the categories are well defined. For more in-depth quality assessments, try mapping. Workflow diagrams, for instance, are excellent for highlighting inefficiency. Flowcharts are great for breaking down the different steps in a process. Neither of these are direct problem-solving methods. They just display information in a manner that makes issues more apparent. To tackle a specific problem, use a cause and effect diagram.
Book 3. Unit 1. Leadership Strategies. Exercise 5, page 5.
From Tom Dillon, Director of Management. To Taylor Hudson, Executive Administrator. Subject: Leadership Strategies. Miss Hudson, I think the recent changes in our management team have decreased employee satisfaction. We need to speak with our new managers about adjusting their leadership philosophies. Many of these leaders are using coercive leadership with their subordinates. We've learned from experience that our doctors don't respond well to that. One example of this was when Dr. Thompson threatened to resign last year. He said he simply didn't feel his opinion was being respected. That's why it's important to encourage a participative leadership style. You should ensure that managers ask for doctors' input more often. After all, they are more competent in their areas of expertise than their supervisors. In fact, I think some of our highly qualified doctors simply aren't being challenged enough. A pace-setting style has helped other departments become more productive in the past. Let's try raising the bar with doctors who are very self-motivated. Lastly, a few doctors have expressed interest in taking on more managerial duties. I think they would respond best to a coaching style. They need to know that we are interested in their personal development. That's the only way we can retain such talented practitioners. Sincerely, Tom Dillon.
Unit 2. Motivational Methods. Exercise 5, page 7.
Motivational methods. The manager's resource. What motivates employees? Employees are most productive when they have the drive to succeed. In your opinion, how can managers motivate employees? First, let's discuss how motivation works. People are motivated by intrinsic and extrinsic rewards. For example, someone may work hard for the positive feeling of doing a good job, intrinsic. Alternatively, he or she may do extra work for a monetary bonus, extrinsic. Both types of rewards act as incentives for employees. Some theories suggest that people are also motivated by certain needs. One of these needs is the desire for achievement. Goal setting is a great way to make use of this need. People can also be motivated by a desire for affiliation. In this case, they work in order to strengthen their relationships. Finally, people are motivated by the desire for power. But be careful with this. It's important to keep the workplace equitable. For their part, managers can use different techniques to reinforce certain behaviors. For example, positive reinforcement and negative reinforcement reward desirable behaviors. These techniques give employees clear feedback about their work. Extinction, which removes rewards in the case of undesirable behavior, can also result in desirable behavior. However, if used inappropriately, employees may see this as a form of punishment. We'll look at some specific examples.
Unit 3. Motivational Tools. Exercise 5, page 9.
Career Now. Employer Ratings. Harris Health Network. Reviewer, Connie A. Rating, 4.5 out of 5. Review.
I'm currently an employee at Harris Health, and I can't give the company enough praise. I love that the company allows me to have a flexible schedule. Having a choice about when I work makes me more productive. Plus, my manager is really inspirational. She takes the time to give me meaningful feedback, both positive and negative, and she always encourages me to express my own thoughts and opinions. This shows that she really cares about our relationship. All in all, I highly recommend working for Harris Health.
Reviewer, Adam S. Rating, 3 out of 5. Review.
Harris Health isn't a bad place to work. It's true that they give their employees a lot of freedom and autonomy. Nonetheless, I can't recommend Harris Health wholeheartedly. I worked there for several years as an assistant director, and I frequently asked for more responsibility. Then I received the position of junior director. Naturally, I thought this was a promotion. However, I didn't receive a raise or additional responsibility. Eventually, I realized this was just an empty change in job title. I wish the company had communicated the conditions of the change more clearly. It made me feel like they weren't concerned with my progress at all. Harris Health is an okay place to work in the short term, but for me, there just weren't enough opportunities for career growth.
Unit 4. Discipline. Exercise 5, page 11.
Olympia Health Partners, Employee Handbook, Discipline Procedures. Here at Olympia Health Partners, we put a lot of emphasis on our code of conduct. And while it is rare that an employee violates one of these rules, it does happen. That's why we have specific procedures in place to discipline employees. Sometimes, problems arise from behavioral issues. Other times, employees fail to perform as they are asked to. In both cases, the employee will first receive a verbal warning from his or her supervisor. Usually, this is sufficient for resolving the issue. However, if the problem occurs again, the employee will receive a written notification of probation. This supervised period is the employee's last opportunity to correct his or her behavior. A failure to do so will result in suspension. In other words, the employee will be asked to leave the office. Usually, this is followed by a termination of employment. However, the company does offer additional disciplinary reviews for certain situations. Moreover, the company must always act in accordance with labor union regulations. Our employees are highly competent and professional. Thanks to this, we rarely resort to disciplinary actions. Nonetheless, all employees should know the consequences of violating company policies.
Unit 5. Ethical Concepts. Exercise 5, page 13.
The manager's resource. Ethics in healthcare. Ethical practices are a critical part of healthcare. These can vary somewhat from one organization to another. However, some principles are important for every manager to understand. Most policies address the need to show respect for patients. This is straightforward in theory, but the reality is complicated. For instance, patients are not always capable of self-determination. That is, they may be unconscious or in shock. Then, a healthcare worker must practice respectful guardianship. He or she must make honest appraisals about patients' likely desires. Confidentiality is another ethical issue in healthcare. Healthcare workers deal with patients' most private information. That's why fidelity is so important. Providers can't discuss certain information with anyone other than the patient, except in certain circumstances. These regulations vary by organization and jurisdiction. So, it's important that managers make confidentiality policies absolutely clear with staff members. Otherwise, a provider might not even realize that he or she is doing something unethical. Different organizations stress different ethical principles. Some encourage providers to focus on patients' welfare regardless of other factors. This principle is called beneficence. Other organizations may request that providers practice non-maleficence. In this case, providers must do the least harm possible to patients. Organizations' preferences will depend on risk aversion and availability of resources.
Unit 6. Rights and Responsibilities. Exercise 5, page 15.
The manager's resource. Rights and responsibilities. Both providers and patients have rights and responsibilities in the healthcare process. The relationship between the patient and provider may be contractual or implied. Either way, both parties are responsible for certain matters. Providers' responsibilities. Providers have a fiduciary duty to patients, so a provider must be fair and act in the patient's best interest. Above all, providers should not aim for personal gain at the patient's expense. In addition, providers must abide by the standards of their profession. This means keeping their knowledge and licensing up to date. Finally, providers are responsible for educating patients about their conditions. That way, patients can give informed consent to treatments and operations. Patients' responsibilities. Patients are responsible for certain parts of their healthcare too. They must understand the practices that they consent to. If a patient is unsure about a particular practice, he or she has the right to refuse it. However, he or she must accept the consequences of doing so. Furthermore, patients are responsible for giving caretakers accurate information about themselves. Likewise, patients must obey the instructions of their providers. These could be related to taking medications, avoiding dangerous activities, or making lifestyle changes. In any case, patients must follow directions precisely.
Unit 7. Cultural and Generational Awareness. Exercise 5, page 17.
From Andrew Peters. To Erica Collins, Hiring Manager. Dear Ms. Collins, I am applying for the position of Community Liaison at your hospital. I have several years of experience working with underserved populations from diverse cultures. I believe this makes me an excellent candidate for the position. Previously, I worked as a liaison for low-income minority groups. My role was part of an overall effort to decrease health disparities in the community. I facilitated communication between these groups and their healthcare providers. During this time, I gained experience working with different ethnicities in a multilingual environment. I believe that my work helped lower health inequality in our city. Now, people of all races and sexual orientations have greater access to healthcare. I currently work for an organization that aids elderly people. Working with this generation is challenging, but rewarding. I am constantly learning how people of different ages perceive healthcare. Furthermore, many patients of this organization have strong spiritual beliefs. So, I've become aware of how religion can affect a person's attitudes towards certain practices, and that has forced me to adapt my communication strategies. As a result, I've become a better listener and communicator. Thanks to these experiences, I am well prepared for work among diverse communities. I believe that I'll be a valuable addition to the hospital's team. Sincerely, Andrew Peters.
Unit 8. Ethical Concerns. Exercise 5, page 19.
East River News. Letters to the editor. Dear Editor, last month, your newspaper published an editorial criticizing healthcare practitioners in East River. I was disappointed that it didn't address some vital factors, namely, the challenges facing both practitioners and patients. Community members must understand how these issues affect their healthcare. First of all, the current laws and regulations in East River are restricting doctors. The widespread institution of managed care has led to the rationing of services. This typically affects those who are dependent on public funding. So, low-income families aren't getting the health care they need. But managed care affects wealthier families too. That's because providers have budget restrictions. So, doctors can only prescribe approved medications from a formulary. This can prevent them from recommending more appropriate treatments for patients. It's frightening to think that this is happening in life and death situations. Our community also needs better education about beginning and end-of-life care. I know that topics like abortion and life-sustaining treatment are controversial, but if we don't discuss them, people won't know what their options are. For example, many people don't realize that the government offers free contraception. Many people may choose not to use this program, but they should at least know that it exists. I'd like to see more thorough coverage of this issue in your newspaper. Sincerely, Brittany Howard.
Unit 9. Legal Concepts. Exercise 5, page 21.
HEA 3020. Healthcare Management. Lecture Notes. Healthcare Laws. Laws protect healthcare organizations, patients, and their providers. These healthcare laws come from a few different sources. Judges. Judges make decisions about issues that are brought to court. So, they have a huge influence on how laws are interpreted. These interpretations set precedents for future cases. Then they become part of common law. Common law ensures that cases are handled fairly and consistently over time. But it's important to note that common law also relies on the interpretations of judges. So sometimes judges' personal ethics become intermingled with the law. Legislatures. Governmental bodies called legislatures are also involved in the lawmaking process. These lawmakers create and pass statutes that become law, or they can overrule a particular jurisdiction's common law. This may happen if they decide that the jurisdiction is upholding incorrect principles. Other lawmaking concerns are not directly issued by judges or legislating bodies. Examples of actions or procedures include preemption. It is used if states or regions within larger political units have their own laws. Preemption determines which law is applicable in a particular situation. The more restrictive law is followed in most scenarios. Binding policies. Organizations can adopt their own binding policies. Although they are not legislated, they are final and must be followed.
Unit 10. Tort Law. Exercise 5, page 23.
Cases in tort law. Presentation instructions. Students should divide into groups of 3 for this presentation activity. As a group, students must choose a recent case involving tort law. Remember that tort cases involve a specific relationship between the plaintiff and defendant. The defendant's alleged breach of duty must have caused the plaintiff to suffer damage. First, students must outline how the defendant allegedly breached his or her duty to the plaintiff. Be sure to show a direct link of causation between the violation and the damage. Then, indicate whether the charges were against a practitioner or an organization under respondeat superior. After that, students should describe the type of negligence involved in the case. For instance, misfeasance is common in the healthcare industry. It occurs when a correct action is done in the wrong way. Unfortunately, healthcare providers sometimes break the law, so your case may involve malfeasance, and a practitioner's carelessness or forgetfulness can lead to nonfeasance. Your presentation can involve any of these 3 types of negligence. Students must prepare a 10-minute presentation outlining the case to the class. They must also individually state whether or not they agree with the results and why. Finally, each group's presentation will end with a short question and answer session.
Unit 12. Contract Law. Exercise 5, page 27.
The manager's resource, contract law. Contracts are an essential part of healthcare law. Because they are legally binding, they ensure that patients and providers fulfill their obligations. An agreement must have a few specific qualities to be considered a contract. A contract is made between two or more people or organizations, otherwise known as parties. These parties must be competent to agree to the contract. In other words, they must be capable of understanding the agreement. Furthermore, a contract is an agreement concerning something of value. Lastly, an agreement can only be considered a contract if it is lawful. Thus, a contract may not bind any party to illegal actions. Now that we've covered the requirements of a contract, let's discuss types of contracts. When people think of a contract, they typically imagine an express contract. This is a written document that the participating parties sign. However, other types of contracts exist too. For instance, people are also bound by implied contracts. The unstated agreement between a restaurant and a customer is a common example. By eating a meal, a customer implies an intention to pay for it. Likewise, a patient's willingness to receive treatment can also be considered an implied contract in some cases. More information on how contracts are used in the healthcare industry follows.
Unit 12. Contract Law. Exercise 5, page 27.
The manager's resource, contract law. Contracts are an essential part of healthcare law. Because they are legally binding, they ensure that patients and providers fulfill their obligations. An agreement must have a few specific qualities to be considered a contract. A contract is made between two or more people or organizations, otherwise known as parties. These parties must be competent to agree to the contract. In other words, they must be capable of understanding the agreement. Furthermore, a contract is an agreement concerning something of value. Lastly, an agreement can only be considered a contract if it is lawful. Thus, a contract may not bind any party to illegal actions. Now that we've covered the requirements of a contract, let's discuss types of contracts. When people think of a contract, they typically imagine an express contract. This is a written document that the participating parties sign. However, other types of contracts exist too. For instance, people are also bound by implied contracts. The unstated agreement between a restaurant and a customer is a common example. By eating a meal, a customer implies an intention to pay for it. Likewise, a patient's willingness to receive treatment can also be considered an implied contract in some cases. More information on how contracts are used in the healthcare industry follows.
Unit 13. Fraud and Abuse. Exercise 5, page 29.
Your Health Blog by Tim Watkins, healthcare expert. Legislation and restrictions. What's the big deal? Lately, I've been hearing a lot of complaints about how legislation restricts doctors. But laws are incredibly important for keeping healthcare providers credible. Of course, the vast majority of medical practitioners behave properly and ethically, but it's important to protect patients from those who don't. Improper behavior can take several different forms in the healthcare industry. For example, doctors can make false claims for services they didn't provide, or they might practice duplicate billing for services that were provided. Similarly, a doctor might overcharge for services by upcoding, and patients often don't know how much medical services should cost, so they don't notice the extra charges. These dishonest practices might be defined as either fraud or abuse. Fraud is a willful act of deception, while abuse is unintentional. Legislation also prevents physicians from having financial relationships with other providers. Doctors shouldn't make referrals based on their own interests, and this includes the interests of their immediate family members as well. Providers need to focus on their patients' well-being, not on kickbacks. That said, there are some exceptions to this law. For more information, click here. Basically, restrictive legislation protects patients and keeps healthcare providers honest. How do you feel about these laws? Leave a comment below.
Unit 14. Education. Exercise 5, page 31.
Career Now. Healthcare Management. FAQ. Below are some of the most commonly asked questions about working in healthcare management. Is your question not answered here? Send us an email.
Question: do I need a degree to work in healthcare management?
Answer: not necessarily. A lot of managers learn on the job. Those who desire additional knowledge can follow up with continuing education if they choose. But it's still a good idea to study healthcare management before beginning your career. We recommend that you obtain at least an associate's degree from a community college. And if you want to get into upper management quickly, you should seek higher education from a university. Employers prefer to hire candidates with bachelor's degrees and especially master's degrees for these positions.
Question: what should I study if I'm interested in healthcare management?
Answer: healthcare management requires skills from several different fields. Remember, the healthcare industry is a business, so you'll need to study the basics of business administration and economics. And as a manager, you'll want to understand the principles of management theory. Those who are interested in upper-level management should consider studying executive management too. A well-rounded knowledge of these fields will help you thrive as a healthcare manager.
Unit 15. Careers. Exercise 5, page 33.
Prima Healthcare, May 25th, Company Newsletter. We'd like to use this month's company newsletter to introduce some new hires. As many of you know, we recently conducted some new talent recruitment. This involved filling several positions in lower management and middle management. But we made some changes in upper management too. We're very excited to have such talented individuals join our team. Here are a couple of those new faces. Many of you may already know Brian Harris. He was formerly an entry-level supervisor in the benefits department. Mr. Harris showed excellent managerial performance and strong financial skills in that position. That's why we've made him our new Director of Compensation. He'll supervise the distribution of our employees' salaries. Based on his previous performance, we believe he'll succeed in this new position. We're also happy to introduce Clara Barnes, the new Vice President of Patient Care Services. Ms. Barnes will work closely with the company's president and administrators. Together, they will create and implement new policies in patient care. Ms. Barnes will have authority over several departments, including diagnostic services, rehab, and imaging. We're looking forward to seeing Ms. Barnes make our patient care services even better.
AVN Pharma Education.